hear a lot of talk these days about online reputation. What does it mean? And especially what I hear from a lot of medical practices and physicians is, how do I fix my reviews? Well, that's a great question. So I want to talk about it less from going back and fixing something and more from the standpoint of preventing something. So that's why I want to talk about vaccination instead of exasperation. When you get a bad online review, it's exasperating. It's easy to avoid them, however, by vaccinating against them. So first of all, let's talk about why we should care about online reputation management, and after that we're going to get into your choices for how to deal with bad reviews online. And then I want to talk about the half-full glass. This is actually not as hard as a lot of people think, and there's a lot of reason to be optimistic. Fourthly, we're going to talk about some of those internal vaccinations you can do within your own medical group or practice to guard against reputation attacks. And then lastly, the real meat of it, I think, is 5 steps for building reputation. So without further ado, let's define online reputation management. Basically, it's defined as influencing perceptions created on third-party websites. These are the big 4 these days that we spend most of our time dealing with, and there's some others that we work with to some degree, but the vast majority of patient reviews are on these 4 websites, and these are the ones that we really work with on a regular basis. Now, who pays attention to them? Good question. The accounting firm PricewaterhouseCoopers has done a study, about 1,000 different Americans, and a poll actually of 1,000 Americans, and what they found was that about 48% of those people read healthcare reviews, and that equates to about 150 million Americans. About a fourth of them, 24%, have written reviews online, and more than 2/3, 68%, have read the reviews online in making healthcare or other purchasing decisions, and that equates to about 102 million people. So a lot of people are paying attention to these. It's pretty important. Now, the Pew Research Center is a fountainhead of information about the Internet usage in regards to healthcare, and they find that about 3 in 4 people go online for healthcare at least once a year, healthcare information. About 3 in 4 also start a search engine, and about 13 of those percent, actually only 13%, I think is the operative word here, about 1 in 8 really started a medical specialty site like WebMD. They actually tend to go more to search engines. So search engines are very important. And according to the Pew Research Center, the numbers are a little bit different. They say a little less than 1/3 have consulted online reviews. Only 7% have posted them. 26% have read or watched somebody else's health online, sort of vicariously. So you can take this as the lower number and the PricewaterhouseCoopers as the higher number. In both cases, though, it's a lot of people. These are important. Well, most importantly, perhaps, beyond the people who are watching online reviews, is search engines. If you Google a practice name or a doctor's name, here's what you'll find in many cases. In the results page, and the search results page on Google or another search engine, you'll see that the practice website will typically be in first place in what we call the organic listings. These are the non-advertised places. And then right down the page there is a bunch of websites for rating your doctor. And here you have a real practice in California, and on the first page, 3 of the top 10 reviews are websites for rating your doctor. And you can see right away they have the number of average star ratings that practice has. So that makes an immediate impression on someone who's maybe looking for a new doctor. They can see at a glance how well this practice is generally regarded out there on the Internet. So this is really important because this is a first impression that cannot be reversed. Search engine is very important.